Hey everybody, it's Ginger, aka the Pain Warrior Princess from Pain Warrior USA. As I promised earlier that I would, I am going live now to talk about what I learned at the stem cell therapy seminar today. It was put on by American Physical Medicine. That's a physical therapy business in South Scottsdale, I think. And they do physical therapy, they do regenerative medicine, they also do a lot of other things, but one other thing that I'm interested in is manipulation under anesthesia, where they kind of put you in like a twilight sleep, and they, just put your body through range of motion exercises, passive stretching, that kind of stuff. So anyway, I have yet to talk to them about that. But as far as the stem cell therapy, I learned a lot today. My top of my head is cut off. There we go, that's better. I want to start, before I say anything else about it, by saying I'm not a medical professional. I've never been to medical school. I'm not a nurse. I'm not a medical assistant. I am nothing like that. I'm just a patient who has had pain for a good percentage of my life, and I consider myself a professional patient because by nature I'm a researcher. I go out, I find out information, I process it, and then I give it back to people in a way that's more digestible, easier to understand. So yeah, that's why I'd like to present this to you, as well as, doing so kind of goes along with the mission of Pain Warrior USA, which is to educate and support and advocate for fellow chronic pain patients like myself. So I'm going to try to get a little more comfortable here and lean back. And if I sniffle a lot, please forgive me. My allergies are pretty much kicking my butt today. So again, oh, hold on. I'll get comfortable here in a sec. All right. Look like I don't have a body, but okay. So again, I can't say this strongly enough. I don't have medical training. Please don't make any decision based on whether you would or would not be interested in trying stem cell therapy based on solely what I'm telling you, okay? That would just be a poor decision. Of course, you can take into account what I'm telling you, but just remember, everyone is different. Whether even stem cell therapy would be appropriate, warranted, something they would even try in your case, depends on your doctor and where you go and all of that. So today, the American Physical Medicine seminar was focused on a certain kind of stem cells, whereas I knew a different kind, and I'll explain that in a minute. I am gathering information from different sources. So like I said, today was American Physical Medicine and the sources that they have for stem cells and the way of doing it that they believe works. And then I'm in touch with another stem cell therapy clinic, and they do the other way. So let me start with what the other way is that I knew of. It's extracting stem cells through, that I knew that was legal. Extract in the U.S. Legal in the U.S. Extracting stem cells from bone marrow or from basically fat, where it's almost like a mini liposuction, and they suck the fat out, and there's a specific name for that, and I can never remember. I get the T and the P mixed up in it. Let me look it up. Adipose, I believe, is what it's called when it comes from the fat. So again, that's a kind of stem cell therapy taken either from the bone marrow or the fat, and that is kind of, what do they call it? I'm so sorry. Adult. It's an adult kind of harvesting technique. So that is not what American Physical Medicine does. So just put that off to the side, but keep it in the back of your mind because that is an option. So what they do is umbilical cord, where they get it is from the umbilical cord. I don't exactly know the correct term that would go after umbilical cord. Is it extraction? Could be. This is not embryonic stem cells. If you all are as old as me or older, I'm sure you remember the first Bush president who was talking about no embryonic stem cells, right? We remember that, of course. This is a different thing. So the amniotic fluid or the umbilical cord cells are donated from women who are knowingly participating in doing so. There are apparently a lot of safety precautions that are taken when it's time for the mother to give birth to be able to get these materials. One example they gave was cesarean section. So that's how it's done, basically. Now, obviously, there are a million other details that I don't know. I probably wouldn't understand if you said it to me, but I was interested in where these cells come from and why they are better or different benefits or different whatever than the methods that I knew of, which was the bone marrow and kind of the fat, adipose. I always mess that word up. I'm so sorry. I have it written down. Adipose. Okay. Another interesting thing that I learned today, one thing that I had read about the bone marrow and the fat, because it comes out of your own body, the chance of rejecting it is pretty much none from what I read anyway. Now, obviously, I'm reading things that are not necessarily scientific in terms of there's no bias. I'm sure what I'm reading has some bias because these clinics and companies would like you to use their product. But anyway, so just to reiterate, the bone marrow and the fat, because it comes from your own cells, this type of stem cell therapy, from what I've read so far, there's very little to no chance of rejection. Okay. The umbilical cord sourced stem cells, I thought there would be a chance of rejection just because it's not your own cells, but apparently there's not, and there's a specific word for that. It's because they are hypoimmunogenic. And the actual name of the product that comes from the umbilical cord blood is called Wharton's jelly. Now, I don't know if that's like just something they pull out of the umbilical cord, or they take the cells and they spin them around, they do fancy stuff, and that's the end product. I don't know. I just know where the source of it is. Obviously, there are a lot of questions that I still need to have answered, but that's why I set up a consultation for Friday morning so I can get more information and evaluate if this is something I would like to try and do. So, like I said in the beginning, just because you're interested in stem cell therapy does not mean that they will do it for you. It depends on your diagnosis and the target tissue, which product would be right for you, just a lot of different things. Also, whether you have something like joint pain, like your elbow really hurts, or you have something systemic like I do, like fibromyalgia, that will depend on how you're treated, what you're treated with. When you can expect to see some results, all kinds of things. So like I said in the beginning, it really is customized to each patient. And even with the information I'm giving you, if you find it useful, that's great, and I'm happy. That's why I'm doing it. But make sure that you do talk to somebody else who knows a lot more than me. Talk to somebody at a clinic. Maybe be like me and go to different clinics and learn what do they specialize in, why do they do it that way, is it more appropriate for your condition to have it done that way or to have it done this way. And there are a lot of different things to consider. This is still something that's very, very new. There's research that exists on it, but I think in my opinion, from what I understand, the best research is just continuing to do it and seeing how patients respond to it. Now, there was a woman today who came in. She, I think she said tomorrow was day 90 after her treatments. And she's had a lot of really great success. I did want to ask her what were some of the things to kind of prepare for after her procedure, because I had heard from someone who has had stem cell therapy done that she was incredibly tired the first few days, which is fine, but it's something that, it's good to prepare for. Sorry. Allergy medicine plus decongestant equals thirsty. So, yeah. you'll want to get as much information as you can about that so you're prepared for it. It's okay if there are some negative things that happen afterwards, at least as far as I'm concerned, as long as I know they're coming. Part of that is a comfort thing and a preparation thing. Let me make sure I have no plans. But the other part of that is an anxiety thing. If I don't know to expect something and it happens, does that mean something's going wrong? Does that mean my body's rejecting it? What does that mean? So that's something that I'm going to ask on Friday. But anyway, she had a really good result. Prior to the treatment, she was in a position where walking was very difficult. She was shuffling along, she said. I'm sure a lot of you are familiar with that. Had trouble going upstairs, bending over, doing, all kinds of things. So she was reading some of her journal entries, and as time went on, she noticed different things that became easier for her to do, which was really great to hear. I'm sorry, I'm just going to share this live on my personal page as well. Give me just a sec. Excuse me. Oh, okay. So it is from the trouble going upstairs, bending over, doing all kinds of things. So she was reading some of her journal entries, and as I was just listening to myself as I was sharing it because it's a little bit behind what I've already said. Very strange. So if I just stand there and look at the screen for a few seconds, now you'll understand why. This live stuff ain't easy. So let me open this right quick. So yeah, it was really great to hear from somebody who had it done and who has had very good luck with it so far. I did get some feedback from somebody else who had it done. I believe it was last week. She's within the 1 to 2 week mark. And she felt like she took a step backwards the past day or so. So, it depends on the person. I'm sure that the lady who spoke today, obviously the good outweighed the bad, the positive outweighed the negative, or she would not have done that. So, just something to keep in mind. And again, I've said this a couple times and I'm going to say it again. I'm not a medical doctor. I don't have medical training. I'm not a nurse. I'm not a medical assistant. I'm nothing except a patient who likes to research things. I consider myself a professional patient because that's what I do by nature. In marketing, I was a market researcher. That's how I started, and it's just something I enjoy. So I just wanted to give you an overview of what I learned today. Again, please, 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 if you are interested at all in stem cell therapy, don't just take what I'm saying. Research it for yourself. As I mentioned before, there are some different kinds of ways to get stem cells, and some clinics do them a certain way, some clinics do them a different way, and there are certain things that are legal within the U.S. and certain things that are not. So one thing that I did mention, I'll mention again because I know it has some moral implications for some people. No embryonic stem cells. They are not being used. It's not legal. So in the U.S., I don't know about other countries. In the U.S., I know about not legal. So the people that I went to listen to today, American Physical Medicine, they use umbilical cord and amniotic fluid cells. And the other one that I'm in touch with that I'll be going to see soon, they extract the stem cells from bone marrow and they extract it from fat. Again, I forgot what that procedure is called or what it's called. Hold on. Adipose. I'm going to tattoo that on my forehead. Adipose. I keep forgetting it. So again, the bone marrow and the adipose comes from your fat. It's like a mini liposuction procedure. And the bone marrow, obviously, you know how that's gotten. It's you drill into the bone, and that's how you get it. And then they inject those after they've been made into stem cells. They inject them back into your body. I don't understand how they transfer those things to stem cells. I don't understand how they transfer umbilical cord cells to stem cells. I don't get it. All I know is that that's where they come from. I mentioned before I do have a consultation on Friday to go in and learn more and ask my 100,000 questions. But I did want to kind of go over a little bit of what I learned today. Let's see, what else is there? There are some other ways to get stem cells, but this particular clinic does not use those methods. And because I'm not trying to give you like a complete education about stem cells, just what I did learn about today, I'm not going to talk about that. But so like I mentioned, they use umbilical cord blood It's a product called Wharton's Jelly. Again, I don't know if that's what they extract or that's the name they gave it, or after they spin it around and do whatever they do to it, that's what it is. I really don't understand that part. I have to look into that. But they did give a nice thick handout with a lot of information in it. It was a really great presentation by Dr. Janae. She's had a physical therapy clinic in South Scottsdale for 22 years this July. So if they've been in business that long, they really know what they're doing, in my opinion. In this regenerative medicine, it is still a relatively new thing, but it's something that has shown great success with NFL players. They've done it, but they have to be, they have to be careful because the NFL is so limiting. I mean, you can't even use cannabis in the NFL. So, there's even for therapeutic reasons. So there's a lot of things to consider. And like I mentioned before, some people might have an ethical or a moral question about it. I saw your question, Jenny. Give me just 1 second. I'll get to that. Like I mentioned before, these are not embryonic stem cells. These are, for this company anyway, it's from umbilical cord, amniotic fluid. The pregnant woman donates this material. She knows it's happening. She has the baby by C-section as opposed to regular delivery, just as a safety precaution, from what I get. So it's definitely something that she's fully aware of. Let me put it that way. I don't know if that would address any of your ethical or moral questions, but it's a little bit different than thinking that it's embryonic cells that you're getting. So Jenny wants to know which insurance would cover it. Yeah, I thought it said would insurance cover it. I wish it would cover it too. I really do. I will tell you it costs less than I thought it would. Now, I'm not going to give you a range of what they said because every condition is different. Now, if you just have like your shoulder joint that hurts, that's one thing. If you have a systemic issue like fibromyalgia, that's another thing. What I will tell you is that they charge per region. And she did mention, shoulder is a region. Sometimes the whole lower back is a region, and it could be 5 injections. So it just depends on what you're dealing with. The cord blood sounds good. I agree with you. I have to say, from what I researched, which was very little before I went today, I knew about the bone marrow or the adipose that they get from your own fat. So they suck it out of you, they do what they do, and then they put it back into you, which made sense to me because you're not going to reject your own cells. But then I learned today that because this umbilical cord blood is hypoimmunogenic, I said it right, hypoimmunogenic, you wouldn't reject it anyway. But there was also another good reason to use that as opposed to your own bone marrow. And I'm probably not going to say this right, it's just the general idea. So like my cells have been in my body for as many years as I've been alive, and they've been regenerating the whole time. That means, and I know these aren't the exact words, but this is how I understand it, that means there are less regeneration cycles left that cell can do or can do effectively. But if it's coming from the umbilical cord, then it hasn't been regenerating. So it's got a lot more, I'm going to say, power left to do that, power and ability to do that. Okay, yeah, Jenny, I can add some links. If you can hear me say this, are you in the Phoenix area or are you somewhere else? Because I'd be happy to put you in touch with Dr. Janae if you are. But I'll ask her for some other like general links with some good information too. Just let me know. Okay, so there was a couple other things I wanted to mention. I'm just checking out my notes here. One thing that, I've experienced this in the cannabis industry too, is that you're in Wisconsin. Okay, Jenny, I'll find some information. I'll post it here and I'll tag you when I do. Okay. So one thing that I was very disappointed to learn, but I'm not surprised to learn, and it's the same in the cannabis industry, like Israel is leaps, bounds, miles, millennia almost ahead of us when it comes to cannabis research and stuff like that. Because of the attitude 30 years ago, where the way to get these cells was embryonic, and the president came on and said, no, we can't do that. It's against the law. It was both good and bad. So basically what that did is puts us about 30 years behind countries like Germany and Spain. She specifically mentioned those countries because they've been doing these procedures for 30 years. So in a way it was bad. In a way I feel like it was kind of good that that was a decision that was made, because one, it did have some ethical and moral questions for people, but also my better half made a good point earlier. It kind of forced the technology to advance and find other ways to do it, like the umbilical cord blood, like the bone marrow, like the adipose, the fat, taking out the fat. So in a way it's good, in a way it's bad. I'm disappointed that we're 30 years behind, but at least we're catching up. So now there are some other specific terms when it comes to stem cells, and I'll tell you right off the bat, I don't know how to say this. I don't know exactly what it is, but you'll see the acronym MSC. M like Mary, S like Sam, C like Charlie. It's something that is in either the bone marrow or the umbilical cord or wherever you're getting the tissue from. But it seems to me that it's related to some substances inside the stem cells that allow them to do what you want them to do. I know that's a very generic, not scientific